I'm David Fitzgerald, a CML patient of more than 10 years and Trustee of CML Support UK.
My name's Dr Gillian Horne. I'm a haematology consultant and senior clinical lecturer at the University of Glasgow.
58% of physicians feel their patients should be more involved in the disease management and treatment decisions.
I don't necessarily think that the finding from the survey surprised me. I think it demonstrates that we're moving to more shared decision making within chronic phase chronic myeloid leukemia.
It surprised me a bit. It says that more than 40% of physicians feel their patients are sufficiently involved in shared decision making. And from knowing the kind of patients that I've met before, that feels quite high to me. For me, the most important key ingredient in shared decision making is mutual trust. I've got to trust my doctor that they've got my best interests in mind, and they've got to trust me that I'm trying to learn and understand about my disease so I can have useful input to the conversation.
Oh, absolutely. I think trust is incredibly important. It leads to open conversation, which allows discussion about shared decision making, but also when you have a disagreement as well.
Yeah. I remember when I was first diagnosed, I saw a sign saying shared decision making is important to our hospital. I remember thinking, why would I want that? I want doctor decisions. And 10 years later, I fully get it. My input is really important and valuable to my consultant to make the right decisions for me.
And it absolutely demonstrates that fluidity of a patient's journey as well, because at diagnosis you can feel quite overwhelmed, and then when you go through your treatment you might feel more confident to make those decisions and certainly have those discussions.
Yeah. Patients can become more involved in managing their disease, I think, in a lot of ways, but for me the number one thing is they need to learn. If you don't understand your disease, you're not going to be able to have a good opinion on it, you're not going to be able to have a good conversation, and you're just going to be in receive mode only.
I think the thing that healthcare providers can do to support patients more is really to give them the power to harness that knowledge, to ask them both open and closed questions and make them feel part of that conversation that we're having every day.
Yeah, I think when you come in as a new patient, you're overwhelmed, you're not in a position to know what you even want or need. But as time goes on, if your physician points you in the right direction, where can you find out information, where can you learn, who can you learn from? It empowers you to come back to the next appointment with a much better idea of what you might want and the right questions to ask.
Yeah, absolutely. Patients tended to focus on stopping or slowing disease progression and quality of life as their top treatment goals, whereas physicians place higher emphasis on molecular response goals alongside quality of life. I think the key factors that are needed for a healthcare provider and a patient to agree on goals is shared language to ensure that there's no ambiguity between patients and healthcare providers at what the patient wants as their goals, but also what the healthcare provider is looking for as well.
At diagnosis, a patient is going to have no idea of what their goals could be. And so a physician that talks to them and invites that conversation will be really useful. Maybe not in the first appointment, but over the first few months and certainly over the first year, a patient's goals will change radically. And it's really important for the physician to help the patient come along that journey and help them understand what they want from their life.
Absolutely, and that just emphasises how fluid that patient journey is, and that discussing with your healthcare providers is hugely important to enable those goals to be developed in a timely manner. So short-term goals are very, very similar between patients, and that we're trying to achieve a molecular response with limited toxicity and ensuring that patient is achieving a quality of life that is acceptable to them with the psychological care that they need as well. Whereas long-term goals can differ from person to person, whether that be that they change their life circumstances, that they learn more about the disease that they have and want to ask questions about their treatment and their management.
Yeah, I think the short-term goals are ones that can probably be monitored in the lab. The long-term goals are probably more one that can be monitored in the patient's emotional well-being and other life changes that they've wanted to achieve and aren't necessarily quantitative all the time.
Absolutely, and I think that just emphasises the role of a multidisciplinary team approach to care for chronic phase chronic myeloid leukemia patients. I think there's so many ways that physicians can communicate molecular response to patients, and it's an incredibly important part of their CML management. One thing that I like to do is use pictorial representation and graphs of the molecular response so that a patient can visualise the change that we're seeing within their disease.
Yeah, I fully agree. Most patients love seeing that graph. Even if they don't understand the number on the graph, they know down is good. And it's really important for patients to understand what molecular response means, because that's going to inform their goals and their treatment and really everything about their CML. So it's really crucial that a physician explains it in a way that the patient can understand. 55% of patients were satisfied that the treatment had no or manageable side effects. And what surprised me about this stat was that 45% of patients maybe felt they had unmanageable side effects, which feels really high to me. And those patients should be having a really good conversation with their doctor about how they can improve or maybe even eliminate those problems.
It does feel really high, doesn't it? And I think that those conversations need to be started.
I think a really good way for a patient to prepare for a clinic is bring some information. There are apps out there now for CML. You can use wearables such as an Apple Watch or some of the Garmin watches to monitor your heart. And so if you've been having heart palpitations, something on there might be really useful for your physician to see.
I think it's often helpful to put a number on the symptom that you're describing. So whether that be that you have a score from 0 to 10 and 0 is no impact at all and 10 is absolutely intolerable, it's really impacting your quality of life. I think it's really helpful for the clinician and also your CML nurse specialist to see that figure and also how it changes with intervention. I think it's really important that we don't underestimate the psychological impact of living with chronic myeloid leukemia. There are a number of support mechanisms in place, and one of them is through your multidisciplinary team within your own hospital, where you can have interaction not only with clinicians, but CML nurse specialists, pharmacists, psychologists, as well as using different CML-associated charities as well, where I find that often a patient support group can be really helpful in alleviating some of those psychological impacts and anxieties.
Yeah, patient support groups have got a huge part to play to help support each other. I mean, there are several online support groups available to CML patients, and you'll find CML patients who've been through nearly every situation there before. So you can find real practical help from people who've been there and kind of done that. And that can really help a patient feel better, feel much less alone, because CML can be quite a lonely disease because you're unlikely to meet many people with it.
I think that clinical teams in the UK are very good at taking into account quality of life and tolerability. But I think if a patient feels that there is something missing in their care or in their clinic appointment, it's important that they discuss that with their clinical team.
Patients have a responsibility too. I think through that shared conversation and trust between the physician and the patient, there can be the quality conversation about tolerability, quality of life and other goals the patient wants to achieve.
And it's important then that the clinical team ask the patient if there's anything that is troubling them or anything that is affecting their quality of life or indeed tolerability within clinical setting, which goes back to why education is so important, and also preparing for your clinic appointment is helpful so that you can have those conversations.
Yeah, I think ultimately a patient that comes along prepared, trusts a doctor and has great communication is going to get a better outcome.
Absolutely. I couldn't agree more.